Yeah, my guest today here on I Care Leadership Live is Jennifer Cosey. She's the president of Eagle Associates, which is a business that helps healthcare practices and dental practices to stay compliant with OSHA, HIPAA, fraud, waste, and abuse, all important things. So, Jennifer, thanks for joining me.
Mike, thank you so much for having me on today. It's really a pleasure to chat with you and talk to practices about what they can do to be better prepared.
Awesome. Well, that is a perfect segue because, that's why I wanted to have you on, is because I want practices to be prepared. I've been in that seat where I was the HIPAA officer. And to be honestly, I did not know what I was doing, fully in that role. And then I've had, in HR, because that's the hat I wear, no pun intended, is I have to administer OSHA rules and OSHA documentation, and then there's onboarding people and training, and so sometimes you wonder, and I'm sure practice administrators out there are wondering, like, why am I doing all this stuff? What are these binders for? Like, what are these forms really doing for me? And so, just wanted to have you on to help maybe dispel some myths and emphasize, the importance of all this stuff.
Absolutely. I would love to. Our whole goal is to simplify things for people
Mm.
because we understand that compliance is one small piece of a huge puzzle for most administrators, compliance officers who've maybe been tasked with being the officer when they didn't really ask for it. And so our whole mission is to simplify and make things a little easier.
Great. Well, I know that the administrators out there appreciate that because yes, their jobs are so complicated. So I guess here's my first question is, because they're doing all these things, right? They're trying to staff their clinics and code things correctly and make sure the doctors are happy and everything. But they may be saying, well, geez, like why do I have to do all this training? Like, don't people just know this stuff? So, like, what would you say to someone that just doesn't understand why all the training and the manuals and everything?
I always say look at it like a risk management strategy,
Mm.
right? So you're preparing your practice for the possibility of getting investigated by a government agency, for the possibility that a patient complains to the Office for Civil Rights that you violated their privacy, for the possibility that an employee calls OSHA and says there's unsafe working conditions. So, all the things you do from training to policies to implementation and certain assessments are done, of course, because you're required to. It's the law. There are standards that require you to do certain things, but also as a risk management strategy to, prepare yourself for possible investigation. But then also on the practical side for OSHA, most practices want to operate in a safe manner. We don't want injuries happening. And so it's actually working to keep everybody safe and preventing injuries and illnesses for staff.
Mm. Yeah, no, I love that you added that part in at the end, right? It is not only are we trying to protect ourselves, but we can protect ourselves by hopefully preventing any of these things from happening in the first place, right? By training people on how to keep themselves safe. I like, for example, in ophthalmology, or really all healthcare, like, we have sharps, we have needles, and there's always the threat of needle stick. I found that just like communication and training was really helpful to reduce the amount of incidents of needle stick injuries. Do you feel like communication and the training part does make that kind of an impact that reduces actual
Absolutely. It's
incidents?
effective in so many ways, from the OSHA side of things to reducing incidents, which leads to more time, follow-up, workers' comp, all, it's more costly in the end run anyway, in
Mm.
addition to the just wanting to keep people safe piece. It saves you time and money in the long run anyway. The prevention, it's just it sounds cliche, but it's really true that prevention does really save.
Yeah, it's time consuming to let's say someone has staying on the topic of needle sticks, if you have to send someone to urgent care, you've got to do the paperwork, you might have to ask the patient to get tested to see if they have any, things that this employee needs to know about. And boy, and then the employee is worried, right? Oh, did I catch something? You just don't want to have to deal with all that stuff. And then HIPAA is another big one. I'm curious, we talk about like training, for example, and how it can protect you. Has there ever been a time that a clinic hasn't had some of their ducks in a row, maybe in training or posters or whatever, and it's hurt them when it's
Absolutely.
come to like an
Definitely happens
investigation or
where
an
training
audit or
is not
something like
always as
that?
robust as we would like, and then sometimes incidents happen after that, and so there might be a privacy incident that occurs because of a lack of understanding of the privacy protocols or things like that. So there's definitely times when a practice has had to go back and sort of fix a problem that could have been prevented with proper training.
Sure, sure. And they can even can they can fines, result if you're not doing the things you're supposed to do? What does that look like?
Absolutely. So both from all three regulatory areas that we work with, fines are a potential issue. So the Office for Civil Rights is the government agency that investigates for HIPAA, and any patient or their representative can file a complaint with the Office for Civil Rights. They don't have to go through the practice first if they don't want to. Of course, we hope that our patients would come to us first, give us that opportunity to make things right. But technically, they can go straight to OCR and say, hey, this is what happened. They violated my privacy by doing XYZ. And then the OCR can investigate that either by sending, believe it or not, an email that says, hey, this is the alleged situation. You have X number of days to respond with documentation that either supports that you didn't do anything wrong or shows what happened. So that's the HIPAA side. For OSHA, any employee can complain to OSHA that something is unsafe in the workplace, and again, OSHA can send a remote inquiry where they would ask for documentation, or they reserve the right to come on site as well.
Mm. Yeah, it's interesting that this is where HR and compliance kind of intersects a little bit because a lot of HR is about communication. And if you're not communicating well or communicating, verbally and listening, you're going to oftentimes have disgruntled employees. They're going to have questions, concerns, and I don't know if I'm curious if you've noticed this, but those are the people that tend to be the ones that raise the issues.
Right. Yeah. If they're not feeling heard, if they're not feeling like things are being addressed that have been brought up, then that's perfect prime time for someone to possibly file a complaint.
Yeah, and so usually you will have little warnings coming up of people talking about things and talking about concerns, and so you have to heed those. You have to heed those warnings.
Right.
Um, I'm wondering, like on the topic of, because I think training, maybe I keep clicking on this topic of training, but I think it's maybe one of the more concrete things that a practice thinks about and does because they do it every time someone is hired, and hopefully they're doing it annually. But maybe that's kind of my question is what's the gold standard and maybe what's the minimum standard on how to do training on in these three areas: OSHA, HIPAA, and fraud, waste, and abuse.
Right. So, of course, as you mentioned, new hire training is foundational. We want to prepare people before they're in situations so that they know what to do correctly. So, that new hire training is the foundational aspect that they should receive, not necessarily day one, but within a reasonable time frame of starting receiving that training. Technically, OSHA says before they're exposed to the hazards that they're going to be working with, which
Wow.
is why a lot of people do that onboarding sort of immediately training. And so, yes, the new hire training is really important. And then annual training or ongoing training is also required. And I've always felt like a lot of practices, it's a difficult thing to fit in, right? It's like,
Mm,
how are we going to get everybody trained every year? And so a common thing is to like shut down the office for a day or the afternoon and let's get all our training in, which is not wrong. But what I've found is that people tend not to retain the information as well if it's a giant cram session. So
mm,
I kind of am in favor of shorter ongoing segments that take place that are easier to digest and retain over time.
hmm. Yeah, I like that. The just the kind of continual drip of information and quizzing and testing people to make sure that they understand, which I guess brings me to another question. If is it required to test? Because I know some platforms will have a test, some systems may not. Is that a requirement? Is it a benefit?
I would say it's not a requirement for OSHA and HIPAA do not require post training testing.
Mm,
The OIG, it's a very interesting situation. I will try to make a long story short with them. But what they did was a number of years ago, they were trying to simplify things for practices who were receiving the same training multiple times through different payers. So they were like, let's simplify
mm,
this. We're going to create a training at CMS that everyone has to take. And then the payer just has to accept your attestation that, hey, I've already taken this training from CMS. I don't need you to give me the same training, over and over
mm.
again. And so they had a quiz with that and required a 70% passing score. That's
Okay.
the only quiz requirement in all of the regulatory areas that we deal with. However, I've always felt like a quiz has multiple benefits. Number one, it gives a quick way for you to document that someone participated because they take the quiz, it shows I took the training. And then secondly, it's an easy way to gauge their general understanding. If they get a very low score, you can say, okay, well, we need to do some additional training or have them meet with somebody or answer some questions and get things to a better level of understanding because the regulations require that your training is effective. And OSHA reserves the right to interview employees if they come on site. They can meet with employees one on
Mm,
one and they would expect them to have certain knowledge.
mm. Okay, sure. And what is that, like talking, because I think most people understand with HIPAA, they understand patient privacy, but with OSHA, there's so many elements to safety. There's chemicals, there's needle stick, there's bloodborne pathogens. What are the main elements of, training that need to be covered as it relates to OSHA?
Right. For healthcare, there's quite a few topics that are relevant. And so you've already mentioned several of them. Bloodborne pathogens is a main hazard in healthcare
Mm,
practices. Chemical hazards are number two. Then there are tuberculosis. Surprisingly, a lot of practices don't have that on their radar, but
mhm,
because it's an airborne pathogen and even though its rates have been on the decline in the US, it is still a hazard that has to be addressed in healthcare. Infectious diseases like influenza, COVID, RSV, that's another hazard that we want to be aware of. Waste management, whether it's pharmaceutical waste, biohazard waste, if you work with hazardous drugs, as a lot of ophthalmology practices do, that's another one. Then you have natural disasters, so emergency preparedness type safety information, and then workplace violence and harassment. Those are all sort of foundational safety topics. We also cover a couple that are not as common, like ergonomic safety, we have a module for,
mm,
and then a series of special safety modules based on what the practice is doing.
mm. Okay. Okay. Is there, when you are talking to clinics out there, and maybe they're calling you in a panic because they got in hot water or they have a problem, or maybe you're just making an initial assessment of their compliance program, is there an area that they tend to not understand that they should be doing? Is there a thing that you think is maybe the top thing that practices should be doing that they're probably not doing?
I think one of the things, and it's really interesting because I don't want to downplay training at all. It's
Mhm.
foundational, it's critical. But I
Yeah.
think a lot of our clients are like, training is compliance. If I've done
Mm-hmm.
training, I'm now compliant. And that's simply not true. You have to
Mm-hmm.
have a set of written policies that you've actually implemented. So that implementation step, I think, is the step that a lot of places stumble on a little bit. And it's difficult because, like I said, time consuming. That's
Yeah.
something that you have to then dedicate time to ensuring that implementation has actually happened.
Mm. And what, when you talk about implementing your plan, so they're probably implementing the training. What are there elements of that plan that you think are, neglected or most neglected?
One of the big ones for HIPAA is the security risk analysis piece that
Mm.
a lot of practices are like, oh, well, my IT vendor handles that for me. And although it's true that your IT vendor is really important, they handle a lot of your security aspects for your network, for your systems. And you don't have to become an IT expert yourself if you're in charge of HIPAA for your practice, but they can't do everything. And there are a bunch of areas within the security risk analysis that are administrative. And so it's got to be a joint effort between you, the person
Mm.
who's the security officer, and then your IT vendor to get that security risk analysis completed and then follow through on corrective actions.
Gotcha. Yeah, I think that, that obviously information security is a huge topic right now. Are you seeing are you seeing like hackers and other people, bad actors trying to, get access to data? Is that exposing like weaknesses in the regulatory in the compliance plan and things that they should have been doing? Is it exposing issues like that?
Absolutely. Because unfortunately, the bad actors and the hackers out there, they know that practices have protected health information. And
Mm.
so that is already a draw for them to attack that area. And I think a lot of smaller practices make a mistake of thinking, well, I'm the little guy, they're not coming after me. Actually, they're coming after wherever there's an easy target or weakness. And
Mm.
so you absolutely could be a target.
Yeah, I love that. That really turns it on its head because you're thinking, "Oh, I'm a small fish," but you have tons of patient data, even if you're a one doctor practice. And yeah, if someone makes a phone call to your office and they say something that they shouldn't say, or they click a link that they shouldn't click, then you're exposing yourself right there. I'm curious about the enforcement trends. I imagine, as the political environment changes or I'm not even sure what other things influence regulatory enforcement, but do you see trends, in that regard? Like, do you see the enforcement agencies harping on certain things more so these days?
Absolutely. So, in fact, they've even announced what their enforcement
Oh,
objectives are, which is helpful.
yeah, that is
It
nice.
can certainly help a practice say, okay, well, I know what they're looking for. Therefore, I know what to do and focus on, which is nice. So, for HIPAA, the Office for Civil Rights had an ongoing enforcement objective to ensure that everyone complies with the patient right of access to their information. There were well over 50 something different enforcement actions related to that principle alone. And then now the current enforcement emphasis is on conducting a thorough security risk analysis and following through on risk management, which means reducing risks to what's called a quote, reasonable and appropriate level, which sounds a little vague, right? But a really good example is one of the items within a risk analysis is, do you have a password complexity policy in your
Mm.
organization? Well, if a practice said, well, yes, I have a password complexity policy, we require 4 characters. The OCR is going to say that's not reasonable and appropriate because a 4 character password can be hacked instantaneously
Mm.
by a password spraying program. In fact, so can a 10-character password that doesn't have any complexity to it.
Mm.
So they're looking at implementing things that are reasonable and appropriate. But the one good thing about the security rule is that it's flexible and scalable to your organization. So as you mentioned before, a single doc practice does not have to do everything the exact same way that a hospital does. Your complexity is different, and therefore, their security rules technology neutral, meaning they're not going to tell you any one specific program that you have to use. You have options, and your IT vendor can help you with finding a solution that fits the complexities and needs of your organization, which is always helpful.
Okay, so do your risk analysis out there, people. I think that this topic is really underappreciated. And just you can ask any clinic that has had a compliance issue, that has had to deal with a HIPAA breach, or that has had, an OSHA audit. I'm sure those folks know what they should be doing. And they could tell you that this is not something to mess around with. If someone wants to get in touch with you and Eagle Associates to learn how y'all can help them with these topics, what's the best way for them to reach out to you?
Absolutely. So our website is www.eagleassociates.net. Our phone number is 800-777-2337. And then our general email is info@eagleassociates.net. So any of those ways you are welcome to reach out. We'd be happy to speak with you. And we still answer our phones. We've got humans manning our phones. So
Oh my goodness. Well, thank you so much. I think that one takeaway, at the very least, of doing that risk assessment, I think that I don't think 90% of clinics are doing that. And so I think if you're listening to this, to do that risk assessment is an important thing. It'll probably be eye-opening. Not only will it, help, you know, re, improve your documentation, but it will reduce your risk. I think you're going to learn things through doing something like that. So thank you for sharing that and all of the knowledge, Jennifer. And that concludes the show. I really appreciate you joining me.
well, thank you so much for having me. It's been great. Been great to spend some time chatting together, and I look forward to it.
Yeah. Awesome. Well, I'm going to stop recording, but we can stay here on. Let me see. Where do I hit that button? Oh,